Ejaculate more and have less risk of prostate cancer? Is that real? I'm Dr. Rena Malik, urologist and pelvic surgeon, and in today's video, I'm going to talk about how often you ejaculate might actually reduce your risk of prostate cancer. Now, before I get into that, let's talk about what your prostate really does. So, prostate is a walnut-sized gland that sits right underneath your bladder, wrapping around the urethra. It functions to produce fluid or prostatic fluid that nourishes and protects sperm. It's like a factory that's constantly producing this prostatic fluid. In many men after 40, the prostate tends to enlarge. This is called benign prostatic hyperplasia or BPH. It's not cancer, but it can cause a lot of bothersome urinary symptoms like difficulty starting urination, weak stream, waking up a lot at night. But separate from that, there's also a risk of prostate cancer, which increases with age, and 1 in 8 men will develop prostate cancer. And this is where our conversation about ejaculation frequency becomes important. So why would how often you ejaculate even matter? Let me explain the theory. One is called the prostate stagnation hypothesis. Now, this is the idea that when you ejaculate regularly, you're help clearing out the prostate gland or cleaning the pipes. You're removing old cellular material, toxins, inflammatory substance that otherwise might just accumulate or build up. Think of it like cleaning out a filter versus letting the debris just sort of build up. When these substances sit in the prostate tissue for long periods of time, there's a possibility that you might get more inflammation or changes at the cellular level that increase cancer risk. And also, there's some studies suggesting that frequent ejaculation might lead to higher testosterone levels. And we know that guys who have higher testosterone levels naturally have a lower risk of prostate cancer. So how many times should you ejaculate to reduce your risk of prostate cancer?